A person is so much more than what their medical record is. And I know a lot of people are surprised that Danbury Hospital even has a community care team, which I was too. I honestly did not know they worked for the hospital at first when I was a case manager. And it just shows how much the hospital cares about the community.
CCT represents this sort of cross-sector collaboration in a service-rich environment where providers who have a regular opportunity to come together and brainstorm and case conference in a coordinated way. When you're at the scariest, lowest point in your life, which is a lot of the folks that we interact with, to have this sort of warm, welcoming, supportive, knowledgeable place, accessible, can make all the difference.
We are looking towards the future. We meet them where they are right now in the community, here, outside, in their homes, at another provider's office, but we see where they're gonna go next.
Our passion makes us different. We really try to understand the root problems and go after them. Whether it's the affordable housing, that means for me, I'm making relationships with landlords. I never really thought about that as part of my job, but it really is important because we're creating these relationships that are going to help our clients down the road.
When we first met, I was still living in the shelter for DV victims, going on almost a full year with no hope until you came in. And you gave me hope that I was going to actually eventually have a home. Just made me feel special, that I'm not alone, that I can call you, and you're not going to be just like, okay, that's nice, you know, that you actually genuinely care about my well-being.
We go in and we ask that additional questions like, what's going on outside the ED walls that's making them come back in, or what's just overall what's going on. So once we're able to do that, that's when we make the shift and the difference is able to come about, so we're able to address those barriers, and we don't really see that in every ED.
Community programs are important for Danbury because as a community hospital, we have a role to play in the economic, the environmental, and the physical health of our communities, to ensuring health and wellness across the entire life spectrum. I think one of my favorite ways that our team is making an impact can be shown through our Diaper Connections program.
When a person cannot buy diapers for their children's health care is compromised. Wet diapers, dirty diapers are not healthy for any child. So for us to be able to provide families with clean diapers helps not only the family with their financial needs, but it also helps keep children safe and healthy so that they can lead a productive life.
We each have a community program that particularly resonates with us, and for me that's our Mission Health Day. And we have a Danbury Mission Health Day every year where we provide care to typically over 300 different community members that come in needing all kinds of care.
WestCon coming up is hosting Mission Health Day for us, where anyone can walk in, no questions asked, and get a physical, vaccinations if needed or if wanted, and then leave just feeling like, you know, everything's in order, and if not, they know what to do next, and it's completely free. Just able to get out there and be hands-on, I think sometimes is the right medicine.
Health implications of diet for hypertension. We see high sodium diets contributing to hypertension, saturated fat, added sugars, all adding to heart disease, obesity, diabetes. So here at the food pharmacy, what we try to do is low added sugar, low sodium, low saturated fat, all to help with decreasing blood pressures.
What we do here is empower our participants by providing an environment like this where people can come and shop and have a grocery store experience, as well as educating them through our registered dietitians who work with our participants to give them knowledge about what they're eating, how they're eating, healthy foods, healthy choices, and teaching them about the impact of those choices on chronic disease like diabetes and hypertension.
Before I worked at the food pharmacy, I was a participant. I was in a position where I couldn't afford healthy foods like this. We had to choose sometimes, you know, are we going to go grocery shopping or are we going to put oil in the oil tank?
I think nutrition is very important when you look at our broad community health, because it's not only about affecting an individual's well-being, but when you look at the larger issues like the burden on the healthcare system, you know, cost of living, it's not just an individual problem, it is a community problem.
Our mission really is around pursuing the impossible as we improve healthcare for all.
Philanthropy is at the heart of our community programs. Without the generosity of our corporate and private donors, the majority of our programs wouldn't exist.
If I had everything I could possibly want, I would guess it would be an endless stream of funding just to make sure that this work doesn't disappear.
There's so many family things that I can't wait to hang up, and they're personal to me, but I also want to show this is where I came from. It's my Jacob.
But I will say that a community care team and working with the vulnerable residents of the city was, you know, I know it now, it's probably one of the most important things I'll do in my life.
Participants come in and, oh, you have to try this. I made this. It's my mom's recipe, but I used something different. Or I went on vacation and I bought this back for you. Or somebody had a baby and they brought me their brand new baby to hold. You know, it's not just a program. It is. It's really a family. It's food is medicine. We call that a fam, but it is. We're a big family.